Well, the time is now 10:30. My name is Derek Newby. I'm your PTTC TTA Specialist, Training and Technical Assistant for Region 6. I'm located uh, remotely in Arkansas, but I'm here for our whole region, which consists of Arkansas, Louisiana, Texas, New Mexico, and Oklahoma. Hope I got all the states right. But we are considered the Southwest. So welcome to everyone to this Interfaith session. Today we're going to explore how faith-based organizations can lead the way in substance misuse prevention. And our session is really designed to be interactive, so your voices and your experiences will matter today, and there will be opportunities for you to share. It's truly an honor to gather here today for this important and timely session because interfaith prevention strategies that strengthen communities really are poised in the right situation right now to make a difference. We live in a time when collaboration is not just helpful, it's essential. And there may be no greater source of strength or trust or influence in our communities than our faith leaders in those faith-based institutions. So why are we here? Because faith communities are uniquely positioned to lead in provision. They offer trusted voices, established relationships, and a deep commitment to healing and hope and service. So when we bring prevention strategies into interfaith spaces, we're not only addressing where we've been, but we're looking at the future. We're elevating resilience and belonging and purpose as well. So today we're going to explore some practical ways to connect prevention with faith-based engagement, from sharing evidence-based informed messages to supporting youth and families. This isn't about changing anyone's faith. Let's make that very clear. It's about activating shared values to promote safety, wellness, and connection. So whether you're a prevention professional or a clergy leader or someone simply passionate about your community, your role in this space matters. And together, we're going to build some bridges and reduce stigma and create communities where prevention is rooted in compassion and sustained by collaboration. So thank you for being here, and thank you for being a part of this movement to strengthen our communities through faith and prevention working together. This is our acknowledgement statement. If you see here, it's just important for you to understand that the opinions that you hear today are described in our document. They are not the official word of DHHS or SAMHSA. And you'll get a copy of this slide deck so you can read this in its entirety. But I want to make that clear for you. We're not speaking for SAMHSA. We're not speaking for DHHS. We're here to share some facts and some science with you. This is our roadmap for today. We've already started our introductions. Thank you, everyone, for sharing where they're from, and we're going to talk about what we learned in the listening session last month, or what was it, month and a half ago, about 2 months ago. We had a listening session. So we came first to this same community, and we asked questions, and we listened and allowed for people to tell us what needed to be done. And that's what brought us to the point where we decided to do this workshop today. We'll talk about the role of the faith community and current trends, give you some options for looking for data to support your actions within your communities. We'll talk with you about some actual action steps you can take and some evidence-based, faith-driven strategies as well. And of course, about making things sustainable. We want things to last within your community. And then you'll have an opportunity to ask some questions, and we'll provide you some answers. And then last but not least, don't leave without doing our evaluation, please. Your opinion matters to us. It is my honor to introduce Reverend Johnny Riley Jr. He's a globally recognized leader, speaker, and advocate for community empowerment, and a recipient of the U.S. President's 2016 Lifetime Achievement Award. He serves as chairman of Bridging the Gaps USA and president of Bridging the Gaps Arkansas, both dedicated to leadership and youth development. As the principal of J. Riley Consulting Group, he specializes in leadership, business, and community development. His career includes key roles in government and corporate sectors, including workforce development and financial services. He is a prolific author and international speaker. Reverend Riley has addressed audiences worldwide on leadership, on prevention, and on community resilience. So please join me in welcoming Reverend Johnny Riley Jr.
Thank you very much, Derek, for that introduction. And let us move forward with what we hear. We have some learning objectives that I want everyone to make sure that you understand specifically what we're going to cover here. This is going to be our guide for our discussion and also help us stay focused on practical outcomes that matter. We're going to list actionable steps that really enhance our support for the faith-based substance misuse prevention initiatives. We're also going to explore evidence-based, faith-driven strategies that help us effectively contribute to the substance misuse prevention. And then the third item is we're going to identify sustainable engagement strategies that strengthen faith communities and their involvement in uh, work for substance misuse prevention. And it's key that we understand that the faith community is ready to be engaged. Why involve the faith community? The reason that we want to involve the faith community is, uh, and we'll ask you if you would like to, if you could add your thoughts in the chat as well, if you have thoughts besides the ones that we're sharing here. Why are we going to involve the faith community? Faith groups exist in nearly every community, not just here US based, but when we say faith community globally. And we're not just limiting this to the Christian faith, we're talking about every faith that exists. There are people that are in almost every community. The second area is we have the faith community. They are credible. It's a group of credible that exist there, and it lends credibility to specifically what we're planning to do. Also, faith groups touch people of all ages, economic levels, ethnicities, and can mobilize individuals. And that's going to be key for those of us who are in this prevention work on this mobilization component of that. And then it crosses over each of the sectors of age, race, nationality, and things of that nature as well. They provide a sense of community and, of course, responsibility, which is important for us to know that I see some people saying safe places. We have to really focus on safe places for people to really be vulnerable when it comes to them talking about substance misuse in these particular areas. Members respect the opinions and the guidance of their faith leaders. That's important, and we're going to talk about that a little bit more about the faith leaders and respecting the opinion of those faith leaders. The faith community recognizes substance misuse as an important issue. Faith-based community leaders, they do recognize that substance misuse is an important issue that needs to be addressed in our various different communities. And then, of course, religion and spiritualities are key protective factors for the preventionists that are on the call. We know we're looking for those protective factors that exist. Religion and spirituality are very key as it relates to that. And so we would love for you to engage those faith leaders, and we could talk about that more later during the chat. The next item that we want to talk about is what have we learned? What have we learned? And I want to thank those individuals who were here on the call the last time. We learned from those particular individuals in that listening session that there were some barriers, there are some current needs, and there's also some strategies that can cause us to actually come together. And one of those challenges is the lack of resources and time. Faith leaders are busy. We talked about that at our last call, and we'll talk more about that this time as well. Um, the perception of misalignment between faith and evidence-based prevention science. We talked about that as a challenge, but there's a conversation that we can have around that. Stigma impacts faith-based settings. That's also a challenge that we deal with as well. The lack of preventionist knowledge and comfort with the various spiritual practices and tradition. We talked about that. How can you, as a Christian, interact with an individual who may be from a different faith, which is what happened when I was in Boston 2 weekends ago, talking with several people from several different faiths about an issue that was important to the individuals that were there in Boston. But we were able to talk about it from a human standpoint and not from a religious standpoint. And all of us agreed that we were there to deal with fixing or helping the community as a whole. Of course, we have the communication challenges that exist there as well. And then opportunities for collaboration, investing in relationship building. A cup of coffee can get you a whole lot of leverage and a whole lot of moving forward in a particular area. Meeting the faith community where they are. We got to focus on the goals rather than prevention substance misuse, preventing substance misuse, focusing on a goal, on specifically what the goal is, which is making healthy communities. You got to offer specific training in those particular areas. Those faith leaders have, in most cases, they have meeting rooms that you can use at no cost at all. And we have to use the commitment to support the youth to gain the buy-in, and of course, engaging the community as well at that particular point. And we'll talk more about that as well. So if you know of any challenges or opportunities that exist, please put those in the chat as well as we move forward on to our next slide. The role of the faith community in community health. If you are a person who studies history, whenever there's been a major pandemic or epidemic that has existed in our world, the faith community has been the one who stepped up. Faith institutions have historically served as a cornerstone for community life, offering not only spiritual guidance, but also social services, education, and healing. Churches, mosques, temples, and synagogues have had a long standing position when people are seeking help, comfort, direction, and support during their times of a crisis. These institutions have often led responses to public health issues, from caring for the sick during the pandemic to housing addicts or during the recovery program. There's trust and, of course, a moral authority. Faith leaders are among the most trusted voices in many communities. Their moral influence, and they've established a relationship and positioned themselves uniquely to speak to the issues of behavior, health, and well-being. When faith leaders address substance misuse from the pulpit, are from the mosque or in community forums, it brings not only credibility, but it also brings compassion and a call to action that helps those congregations move from point one to point 10 on making something happen. So they have the trust and the moral authority. Also, it's a long-term engagement. Unlike the short-term programs, and many of us who are preventialists who worked in this field understand that the program moves on, but the problem still exists. We here at the faith leaders and faith institutions are embedded in the lives of those individuals in the community, not just for one generation, but for multiple generations. Their presence provide a continual opportunity for a sustained engagement with individuals and, of course, the family. And the longevity enables them to walk alongside individuals through their recovery journey, also through the prevention journey. And it's not just when a person is facing a challenge, they're there through the entire life cycle. And that's why faith leaders are key to us working with them at this particular time. And if you have some comments that you would like to add, you can add those in there on why we need to engage with faith leaders as well. When we look at the faith leader's role across the spectrum of mental, emotional, and behavior intervention, we look at those four different areas. We have promotion, prevention, treatment, and maintenance. And of course, we have the recovery component. But we're here to talk about prevention. And I'm going to focus on continuing care. Promotion and prevention is what I want to focus on. Faith leaders, when they talk about promotion, can build healthy, resilient individuals when it comes to this. How can a faith leader do that? They can use sermons, teachings, spiritual practices to promote healthy behavior, coping skills, spiritual well being. They foster hope, purpose, and connection, which are protective factors against substance misuse and mental health distress. They can advocate the healthy lifestyle as a spiritual responsibility, helping those congregants see self-care and mental health as a consistent with their faith. An example is a pastor can, on a monthly basis, create a healthy message during the service on topics like stress, sleep, and of course, setting boundaries. And the second component that we want to focus on is prevention, reducing risk and strengthening protective factors. Faith leaders often can provide safe, stigma free spaces. I'm going to say that again. They can provide the stigma free spaces. How can they do that? When we as preventionists go in and have a conversation with them, we can talk with them specifically about how to create a stigma free environment where the community members feel seen and supported before the crisis occurred. They can collaborate with us public health professionals to offer educational events, parent workshops, youth mentoring program. We can identify the stages of risk or the signs of risk before they happen. And we connect individuals to resources before the problem actually escalates. The mosque, for instance, when I was in Boston, we talked about how this particular mosque had a youth leadership program to talk about substance misuse and using prevention skills to help those individuals who were in environments where it was conducive, and also it was known for individuals in those areas to be actively involved in substance misuse. When it comes to treatment, of course, we know faith leaders are not clinical providers. However, they play a very supportive role as it relates to that. And of course, on the maintenance side, we have to remember faith communities are critical to long-term recovery and prevention. On promotion, they can build healthy communities by providing hope, purpose, and connection. When it comes to prevention, they can reduce risk, strengthen those protective factors, and of course, create a safe, stigma free space. And for those who are always looking for spaces to do things, I guarantee you the mosque or the church are open to you using their particular facility as it relates to that. And I'll turn it over to okay, current trends. Let's talk about current trends and in region number 6. There should be information provided to you, the emerging data, drug data source document that the audience will receive. But here in region number 6, which consists of Arkansas, Louisiana, New Mexico, Oklahoma, and of course, Texas, the states that collectively they've experienced significant substance misuse challenges, according to the recent reports from SAMHSA, and that is the Substance Abuse and Mental Health Service Administration, and of course the state health departments. Opioid overdose rates remain high, particularly in Texas and of course Louisiana. Methamphetamines use continues to rise in rural areas across Arkansas and Oklahoma. Access to treatment services. Access to treatment services is one of our issues. with underserved population in both rural and urban communities. And that's a significant barrier. This is what the data has shown us. Youth and adult trends. Youth in Region 6 particularly are vulnerable and they're increasing experimentation and guess what? Vaping, marijuana, prescription medication. Social media is influencing that as well. Mental health struggles and peer pressure are contributing factors as it relates to that. Among adults, we have alcohol misuse remaining a leading concern, following closely by opioid dependency. And this dual diagnosis of substance use and mental health disorder is rising in both populations. I want to say that again. The dual diagnosis is creating some issues because you have substance use and mental health disorder are actually rising at in some places at the same level. The rural and the urban disparities. Substance misuse affect both the rural and urban communities, but in different ways. In the urban area, many have more treatment centers, prevention campaign. Yes, they also face the challenges like homelessness, drug trafficking. When we move to the rural areas, in rural communities, they often lack resources, transportation, healthcare infrastructure, resulting in underreported cases and limited access to care. The faith community in these areas often serve as the only consistent resource for prevention, education, and recovery support. I'm going to say that again. The faith based community in these rural areas often serve as the only source of consistency and prevention education and recovery support. What substance misuse issues you have seen in your community, and you can post that inside of the chat area as well. Substance misuse is not confined to a single demographical area or location. It impacts individuals and families across, guess what? All sectors. All sectors. We have to for youth vape and of course what it did marijuana use, alcohol dependency, trauma-induced substance misuse, and then of course the silent struggles with opioids and methamphetamines in rural communities. I'll turn it over to Derek at this point.
Thank you, sir. Well, uh, although we have the opportunity to share that data with you, we want to make sure that you know where to go find data for yourself. And that's why we have this list created for you. The behavioral risk factor surveillance system. It's where you can find some great information about adults and health trends at your state level. You also have the youth risk behavioral surveillance system, and that's an excellent source for youth trends and substance use. And then there's the National Survey on Drug Use and Health, which is a go-to for understanding like a broad substance use patterns. And then SAMHSA, of course, going directly to SAMHSA, you can also get publications and dashboards and interactive tools. And then you look at community level data sources, and there are several options that you have, localized and insights, gives you insight into people's attitudes and behaviors and perceptions related to substance misuse. It's really good for tailoring strategies to community needs. Key informant interviews it's always great to utilize. So it gives you some in-depth perception and perspectives from your community leaders and your health educators, and also even from law enforcement. So this list, we put it into the chat for you. You can click on any of those links, and I encourage you to save those. Of course, again, we're going to share this slide deck with you as well. So, chat question for you now. Who here has ever worked with a faith-based group in your prevention work? You can just answer in the chat. And what worked well during that relationship, and what would you do differently next time? Because now that we've explored the value and the role of faith-based organizations in prevention, we're going to move to the the next chapter in this presentation where we talk about how we move from inspiration to implementation. So we're going to be shifting from theory to action and identifying some concrete steps that communities, coalitions, and systems can take to partner with and empower faith communities in substance misuse prevention. So think of this next section as a toolkit for opportunities and ways to create sustainable engagement and amplify protective factors and address real world challenges collaboratively. So everything involves that first step. So if you're going to even walk across the world, it still takes the first steps. And when you're just starting out, it's important to begin with intention. So you ask yourself, why do I want to partner with the faith community? Is it because I've noticed that there's an absence in prevention conversations, or are you just looking to build trust where there's been hesitation before? But you start by getting a sense of what's already happening in your area. And you ask, are there faith-based groups already offering youth programs in recovery support or wellness activities? And you might be surprised at how much prevention work is already underway, just under a different name. So you move to the next level where you start building those relationships. And relationships are everything in this work. A formal meeting isn't always the best starting point. So start thinking informal, like Johnny told us, like lunch or coffee. Because if you know someone who knows someone in the faith community, that's your open door. Start there and build genuine connections. These first steps are about listening, learning, and laying the foundation. Don't rush the process. This is about building a partnership, not making a pitch.
All right, thanks, Derek. And here's some actionable steps for faith-based prevention. These are simple steps that we would like to share with you as well. And the first one is host prevention workshops. Faith communities can organize those workshops that establish and educate congregants on the risk of substance misuse, signs of addiction, the role of faith in healing. And the preventionists that are here on the call, you can help them by providing that data. There could be a youth night, there could be a small group session, community days to ensure access to this information is to all of the age groups. Of course, you can train the leaders when it comes to mental health and prevention. Mental health first aid is a push. In the state of Texas, every single teacher in the state of Texas is required to have mental health first aid for youth. So, and those programs are available, and in many cases, those programs are free. But training the leader as it relates to mental health. Also, we have to promote counseling. The church can destigmatize counseling by openly promoting spiritual and professional mental health support. Offering confidential pastoral counseling, partnering with Christian counselors, developing a peer support group that allows struggling members to feel seen, supported, and, of course, guided. And then, of course, awareness campaigns. Faith organizations are uniquely positioned to raise awareness through annual observation like Red Ribbon Week, Mental Health Awareness Month, and of course, Hope Sundays. Here at the church where I pastor, we do have a mental health awareness campaign that takes place. We do provide mental health information as it relates to that. So we promote those things, and we have health fairs that are here at our church as well. But those are easy, actionable steps that we can help from a prevention side with those individuals who need support from the church side. Build the congregation support. We can equip the leadership. We can develop teams. We can sustain that particular ministry. And let's talk through that. SAMHSA was the first agency to undertake specific faith-based community initiatives in 1993. And they had a direct relationship with the faith-based community. And of course, building community congregant support, one, readiness tools, and of course, strategies when you're having coffee with that faith leader and the person that they've designated as a person to be the lead there. Equip the leadership, training, We have training up on top of training. If there's a faith leader that you know that should have been on this call, send that information to that leader that's in your community and then have a conversation about the information that we've shared. Develop the team. Faith leaders, many of us are really, really busy based on our schedule. However, there are ways that we can actually help and assign somebody to help with that and become a community resource. Make sure the pamphlets there in the lobbies of these faith community. And then, of course, you want ongoing education when it talks about sustainability, networking, planning, the evaluation, and of course, program. Share the program with those individuals who are there during those particular meetings as well. And then we want to the actionable steps directed toward the clergy that are here. Protestant, Catholic, any school of theology typically, and I know my training included dealing with the issue of substance abuse, substance misuse. When I was going through, it was substance abuse. The name has changed to substance misuse, and then recognizing what the signs are. So we can train the clergy to recognize those particular signs and symptoms. We can train clergy on how we can train clergy on how to make references to the treatment and strategies, relapse prevention. Educate the educate the clergy about the core currents of mental health, and then of course other problems. Educate the clergy member on specific on where training is available. We can encourage, the message for substance misuse issues and formally include messages about the program throughout the program. It's important for us as clergy to deliver the message in a sensitive way to the congregation that we have. And it's important for us to be able to work with those individuals who are in the field of prevention.
So, togetherness. And this is what we want to really display with this slide. There's the prevention community, there's the faith community. But if we use the evidence-based approaches, that's where we come together. Because evidence-based doesn't mean we leave faith out. It means we use proven models that incorporate our faith values. So what makes a strategy evidence-based, you may ask yourself, and it's listed right here. And simple, like, it's about making sure that it demonstrates effective strategies that have been proven in research. The research has to be done, whether it's in the research, what it gives you the confidence in is that research shows measurable positive outcomes in reducing substance misuse that are associated with risk factors, which means you don't have to guess about this work. You can use the evidence-based strategies and feel confident that you're going to make a positive change. Evidence-based means that it's been published. It means that there's a theoretical foundation behind what you're doing, and it has fidelity, and it can be replicated over and over and again. It can be implemented by trained practitioners with fidelity, ensuring the core components remain intact while allowing appropriate adaptation. And like we talked about at the very beginning, it's sustainable. The evidence-based strategies are often tested in real-world settings, and they show that it can be scaled across different community size and population. They demonstrate long-term impact. So it has been reviewed, it has been endorsed, and like the list says before, you can have confidence that it's going to work within your community if you utilize it. And that's what we want. We're trying to take the guesswork out of the work. Now, you looked at this earlier, but I'm bringing it back to you so just to reinforce the fact that there are some things that we know that are evidence-based, that have worked and that have been used in the faith community. Celebrating families is one. We also have Too Good for Drugs and strengthening family programs. All these three that we have listed there, this is not an all-encompassing list, but we know for sure these are three that have worked. The Celebrating Families, it's been listed on SAMHSA's NREP, and it focuses on strengthening parent skills and reducing substance misuse risk. Too Good for Drugs, it focuses on substance use prevention. It includes building decision-making skills and social emotional skills as well. In some churches, integrate this program principles into their youth programming. And then strengthening families, it's also evidence-based, it's listed in blueprints, and it's all about building family bonding, communications, and resilience, and then also reducing risk factors. The audience for this one is usually 3 to 16 years old.
As we look and selecting the evidence-based intervention, there's several programs that are out there. This information will be given to you on the slide, and there'll be a hyperlink as well there. But choosing an evidence-based intervention ensures that the efforts are rooted, of course, as Derek said earlier, in research, is proven to work, and most likely to secure funding and, of course, policy support. These interventions, of course, we understand, offer tested methods with measurable outcome to reduce substance misuse and strengthen those protective factors. Where to start? We have to have reputable sources to develop that. Excellence in prevention is one of those sources that is there. It's developed by prevention professionals. It offers guidance, planning tools, and a list of effective programs. It's great for navigating the full prevention process from planning to implementation. SAMHSA, of course, have the evidence-based resource center. There is vetted by SAMHSA, and you can search by topic, by population, by setting, and it's very prevention focused. Then, of course, you have the Blueprint for Healthy Youth Development is another source. It's focused on youth programs. It has standards, and then, of course, those standards, there's evidence-based standards. Those standards are actually proven. It's categorized interventions for promise. There's a model that's there as well. We have all kinds of information that's there to actually help you through the process. What works for help is county health rankings. It's a broad resource that link social determinants with health outcome. It includes strategies beyond substance misuse like education, housing, and of course economic support. Then of course you have the Colorado menu of strategies, community organizing for prevention. That's a state developed toolbox that's available with strategies that are there based on community needs. Of course, it has data that's there, and it highlights culturally appropriate information and practices that are there as well. Then, of course, we have the best practice register. It's developed in partnership with Suicide Prevention Resource Center. It includes programs that support behavior health promotion and prevention, including faith-based approach. The choosing the right fit. You have prevention is not, you got to understand, prevention is not a one size fit all. I will repeat myself. Prevention is not a one size fit all. You have to use your local data. You have to get community input to guide the process, and you have to be able to adapt based on what's needed to be sure you maintain the fidelity to the core competencies of those particular items. And that's going to be very, very important for us and for you as well. So selecting the evidence-based intervention, and that information is provided to you as well. And thank you, Richard, for your support. Well, making sure we stay on task as it relates to that. Evidence-based, faith-based strategies. Uh, Strengthen economic support for the family. Of course, we strengthen the household for financial stability. Promote family-friendly work policies. Then, of course, connect youth to caring adults and activity. There's a mentoring program, an after-school program. And these are evidence-based, faith-driven strategies. Promote social norms that protect against violence. Men and boys are allies in prevention. Public prevention education campaign. And of course, we have programs that are evidence-based that are working. For instance, here at our church, we have the Celebrate Recovery program, which is a Christ-centered program that really helps individuals overcome hurt, habits, and hang-up. Our program is not specifically focused just on substance misuse, but we do know individuals face substance misuse issues, also has some additional trauma maybe in their life. Mental health first aid for church leaders. There's a program that's designed for that. In our community, we have encouraged not only those individuals who are in the school system, but also church leaders to be involved with that as well. Of course, coalition partnerships. For those who apply for the DFC grant, there is a place for the faith community to partner there with the coalition because they provide help there when it comes to some of the mobilization issues that you may have and that you may need. And of course, we need coalitions. We need local prevention teams. We need partnerships with the public health officials, and of course, different groups because we may not have all of the funding that we need. But just imagine if a group agrees to host our coalition to attend that particular meeting. So there's evidence-based programs that are faith-driven, but these strategies have been known to work and to be effective in delivering what needs to happen when it comes to us making a difference in the community, specifically around substance misuse. There's a chat question that we have next. What faith-driven prevention strategy substance misuse? If you could, would you enter that information in the chat area, if you don't mind? What are those strategies that have worked in your community to decrease these particular issues? Some ideas that have come across is weekly prayer and recovery meetings, support groups held at the church, celebrate recovery, training at the church. You're right, naloxone training at the church. That's important. You can have testimony services at the church in a recovery Sunday where you celebrate local faith youth groups utilizing prevention programs. Yes. Youth led prevention campaigns. The church has the power to bring youth together to design and, of course, lead a campaign as it relates to that, using music, skits, of course, social media to raise the awareness. Church school partnerships. That would be great. Pastoral counseling with a referral network. Many pastors may find themselves counseling. And in our training, we were told that guess what? If it's too heavy for you, you need to transfer it over, but don't wait until it gets too heavy to transfer. So establish your network of counselors that you can do some transfer of services to, especially when you're dealing with mental health issues and recovery issues as well. And then, of course, healing and delivery services is also things that we can use as it relates to reducing substance misuse in our various different community. One thing is for those preventionists that are here and you attend a church, a synagogue, you can actually go to the pastor or to the imam and have a conversation with them and ask them, can they have time on that service during the announcement period to talk specifically about substance misuse and the impact it is having there in that particular community, and ask for volunteers to help you set up this particular thing that you want to do there as it relates to substance misuse in the community. So now, Derek, I'll turn it over to you.
Well, thank you, sir. This is a logic model, and I think many of you have seen a logic model before. If you've seen a logic model before in the chat, just simply type a yes. If you've never seen a logic model, then put no. I should see a whole flood of yeses. But if you haven't seen one, I need to know. Okay. Yes, 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 yes. Okay. How many people do we got here? Almost 198 people. So I'm getting flooded with, okay, I got one no, more yeses. Okay, good. So logic models help you.
Another no, Derek. We have another no.
Probably no.
No.
even if you haven't seen it like this, you've used logic models, whether it be from deciding how you were going to take a trip to Chicago, or even how you were going to plan a event at your church, or anything in life. We use logic models. This particular one helps us to decide how we're going to get to the evidence-based intervention. So we've given you a whole group list and everything like that for you to choose from. We've given you the resources for you to go to choose them. But first you have to decide what the problem is within your community. And if it's, here's for example, if it's underage drinking, the next thing you look at is what are the risk and protective factors within my community? What if the risk is high level of social access, meaning that there are too many liquor stores within your community that are serving the underage youth. Another risk factor would be a lack of parental monitoring. There's such a high burden for work within your community that the adults aren't really having the opportunity to supervise their youth. So it could be a lack of parental monitoring. And you'll find this out by looking at that data that we talked about earlier. Your data from those research documents will let you know what the risk factors are within your community. You don't have to guess about this. Whether it be youth, low perception of harm, when they do the assessments at the school of the youth, you get a number, you find out, you can go look and find out whether there's a low perception or a high perception of harm when it comes to a particular substance within your community. And then protective, school engagement. How engaged is your school? If you have a very well engaged school that is talking about this and provide mentorship to the youth, then that's a protective factor. So our schools can serve as a protective factor within our communities. But when you know this, that's when you get to what we talked about earlier, the evidence-based interventions. You can start deciding which is going to work best within your community. So thinking about your community, what evidence-based intervention could your faith-based community use to address this problem? You don't have to answer this right now, but I just want you to think about it. You know what your problem is. You now know where to go find the evidence-based strategies, and you know where to go find the data to support what the risk and protective factors are within your community. So just make that a project of your own, and then you can decide then what is going to be the best fit for your community, because interventions have to be conceptual and they have to be a practical fit within your community. And the resources that we've given you have given you a great deal of information to choose evidence-based interventions. However, just because they're evidence-based doesn't mean they're going to be a good fit. So that's why you have to know what those risk and protective factors are as well.
Thank you, Derek. And the sustainable engagement strategies are in these areas. What I encourage you to do is establish a prevention ministry. You have to create a dedicated ministry team within the church to ensure that the substance misuse prevention is treated as a long-term mission-driven priority. The ministry can oversee workshops, youth engagement, counseling referrals, serve as a primary liaison with the community, help partners, appoint leaders and volunteers who are willing to work through lived experience, and of course, have training, and you want credible training, and they have to have the passion. You want to build regional partnerships. Sustaining this partnership is going to be important because you have to have collaboration. Those who are in the Christian faith, you have these associations and that meet on a regular basis. Those are where you can establish those regional partnerships, and you can have regional coalition with the public health department. Prevention nonprofits can leverage funds, training, evidence-based material. Of course, you want to invest in the youth and the youth leadership. Of course, youth are not just the future, they're a vital role, they're a vital participant in the development of these strategies to make sure that they don't face the temptations that we face when it comes to these substances. We can do youth leadership programs over the summer in the school system. We can do peer mentoring program that cultivate resilience and responsibilities. We can have prevention themed Bible studies. We can have service projects, leadership council, youth led events that address real life issues. Of course, we can host annual awareness events, hope weekends, red ribbon observation, as we said earlier, mental health Sundays to keep the topic of prevention visible and normalize the conversation around substance misuse and healing. These annual moments emphasizes to the congregation how they can help. It creates a rhythm of awareness, reflection, and then, of course, action. And that is important for us to know those. There are 10 sustainable engagement strategies. Build long term relationships. We have to cultivate trust. Trust is important in this. And how do you develop that? Consistent communication, shared values, and follow up beyond that one time event. Shared leadership and ownership. Empower faith leaders and members to co-lead the planning, the decision making, and of course the implementation area. We have to be community and spiritually relevant. We have to be culturally sensitive and relevant to the particular issue. Align our programs and our messages with theological, culture, and historical context of that particular community. You have to know that particular community. The capacity building, provide leadership training, you need technical assistance and resource to help groups sustain their own efforts. I'm going to say that again. We have to be willing to move it from the preventionist side to become a part of the regular activities in the community. And we normalize this conversation when we're moving to sustainability. We have to have feedback and adaptability loop. We got to create ongoing channels for community feedback. We have to be willing to take surveys as you're going to take here afterwards. You want to have strategies that can adapt to the needs. And we also don't want to remain, relevant to what we're called to do. We also, let's move on, Derek, I think on number 6. Okay, we have to be visible. We have to acknowledge. We have to celebrate specifically what those faith leaders are doing and do public recognition, share spotlights. We got to integrate the programming into existing ministries and programs, the youth group. Don't create a brand new ministry. Integrate it in and give this particular ministry group the assignment to take on this particular task in the helps ministry in the Christian faith. You have to do some outreach services, multi-sector collaboration, public health, education, law enforcement, the local nonprofits to ensure that there's sustainability. And of course, this funding conversation, all of us are talking about funding. Where's the funding going to come from? In each community, we have what it takes to make this happen in our particular community. We have to assist groups that in identifying funding sources, in-kind contribution to reduce the financial burden on one organization and eliminate those barriers that may exist so the work can continue. And then succession planning. We need to prepare youth to lead in the future. We need to have youth as a part of our coalitions and our partnerships and invite them to those meetings where they can understand specifically why decisions are made in order for us to continue to sustain what we're doing as it relates to the what we're doing. So some examples of bringing individuals together. These are some of the things that we do on a regular basis. We bring individuals together to talk about the topic of substance misuse. And for instance, in our county, we have a Bible study on Wednesday at a community center where we bring in various different pastors, and then on an annual basis, we bring them in and have a conversation with them as it relates to substance misuse. We raise awareness by providing the church educational opportunities, for instance, as it relates to the prevention efforts that are taking place. We have those conversations in those meetings with those key leaders. Create an annual Hope Day or Hope Sunday and make it a county-wide event and allow all the congregations to be engaged in this to empower those particular churches to have their own. We provide opportunities to churches to become more involved in these community efforts. We have to have a multi-pronged approach. We have to use our networks in order to make this work, in order for us to be successful with what we're planning to do. So we'll move on. Derek, I think you're up next.
Wonderful. It's time for just a small group discussion. So, in this discussion, I hope that we can uncover what's holding you back. We've shown you the path forward, but what barriers prevent long-term engagement in your particular congregation, in your opinion, right now? And then, second question I want you to answer in the chat is how can we use what we have learned to overcome the barriers? If there's someone out there with their soul ready to speak, please feel free to unmute your microphone and answer both of those questions for us as well. We got time for at least 2 people to do so. So who would like to open their mic and answer those questions while others put it in the chat? Because we're going to save all of this and we're going to be reviewing it, but we also want to give you the opportunity to speak at this time.
Hi, I'd like to, Catherine here, Catherine Miller from Massachusetts First Baptist Church, Westwood. So for someone in my situation where, what do you, if anyone could speak to, I am the newer pastor, 2.5 years in. This is not my first pastorate, but my first pastorate in this community. And it's a very well-resourced community as far as the income levels. And so there's a lot of protection around my community because of that. And our coalition in Westwood, Massachusetts, we're in the process of, I'm part of the coalition and we're applying for the grant. They had previous drug prevention grants, and now it's a new coalition with many more stakeholders in the community. So it's really good. That's how I actually got to this. So for someone in my situation where we do have a lot of slowly things are just moving, and small groups and just reaching different vulnerable communities from seniors to youth and just trying to rebuild and refresh. I do have background in another context with the drug prevention, homeless community, things like, mental health, general pastoral supportive type thing. My husband's also on this Zoom as well. But for someone in this position where I am, I took a lot of notes that integrate prevention ministry. I think that's what I'm hearing my coalition we're wanting to do, but for my specific church, am I correct now that I'm collecting this information to in the near future begin to roll it out, right?
Yes.
Rather than trying to
Yes.
jump in and run with it right in the middle of where we are.
Yeah, yes. And I'll take that, Derek. And, it's a slow process, the first couple of years in ministry and a new location, that first year, everyone's filling everybody out. And now there's time where you can actually have conversation with those leaders and those individuals who are part of your congregation that have a passion for the helps ministry, and talk with them about how best to implement this as a part of the ministry that are already established. I would not say create a brand new one because that's a whole lot of complication as it relates to that as well. But tag it on to someone who has the passion to take this on and make it happen, and don't carry the burden just by yourself. You understand what I'm
Right.
saying? Because
Yes.
sometimes what we have the passion and the drive and we have the vision, but we need to bring some people along with us because we're talking about sustainability as it
Exactly.
relates to this. And so I would encourage you to bring some people along with you, and we can have another conversation specifically about how to make that work and establishing, those roles and responsibilities as well. And Derek can share my information with you because there's a couple
Amen.
of other things that I can share as it relates to that as well.
Amen. Amen. Thank you. Yep.
Okay.
Leadership development, delegating. I don't try to do it all. So that's where I'm
Yes,
doing
yes,
with some other stuff. So I don't want to pile
yeah.
up on people, but I'm excited as you hear. I
Yes,
appreciate your
yes.
information. Thank you so much.
You're welcome. Okay, thank you. Is there anyone else who has questions or comments?
Hello, can you all hear me?
Yes,
Okay, my name is
yes.
Raquel Barber. I'm with Friends for All here in the Memphis, Tennessee community. So I'm very new to the role of specifically working in faith-based. I've been in outreach specialist work for almost 3 years now, but this is my first time where my title is strictly geared towards faith-based. Now, of course, I've grown up in the church, specifically like the Black Southern Baptist part of church. So I'm kind of familiar with the way things go, but something that I'm kind of struggling with is building that community of like where to find the faith-based leaders or kind of like where to meet them. Of course, Sunday they're really focused on church. On some of those days is even like if they have a Bible study or something, they're kind of focused on Bible study. So something that I've been trying to get is one, breaking that stigma with me being in the South. A lot of people, of course, either equate sexual health or even just like getting tested and knowing these things with LGBTQIA issues
Hmm.
or trying to just access them in general to kind of open up their conversation because they know about the risks that are out there. They also know about the way Memphis specifically is affected by HIV and syphilis, but it's
Hmm.
kind of opening up that conversation. I'm trying to find a way to really navigate the conversation so they feel a little bit more comfortable with leading these conversations in their spaces.
Okay. All right. Thank you very much for your comment and the work that you are you're working in. And I come from the Baptist Methodist non-denominational conversation, and the key is finding whoever the leader is of those particular groups. There's typically going to be someone who's in that geographical area. It could be the moderator, it could be a senior pastor that's been around some time, and have the conversation with them. And you got to have a very candid conversation with them with data. For instance, in your area, here's the information. If you notice, Derek and I, we talked about this data thing because some people don't believe that there's a problem that happens or is in our community. And so well, you have to be able to say, here's what's happening, here's the data source for those who doubt, and then take the data and say, here's how we can help you deal with this issue in your congregation. And here's some talking points for you, because some people who are in the who are pastors and leaders may not even know how to have the conversation. When I first did a sermon as it relates to mental health in our congregation, there were people looked at me really strange, but I took biblical characters in the Bible and showed individuals, here's a mental health situation in the Bible, and they never thought of it that way. At the end of the service, I passed out a document with the details, because of course we know when we're speaking, people are in and out of our conversations, and so what we're saying. So I was able to give them a sheet of paper that says, from a biblical perspective, here are individuals who dealt with depression, suicidal ideations, all of those things from a biblical perspective. So what I encourage you to do is, get the data, meet with whoever that particular leader is. And if you're a member of a particular congregation, talk with your pastor and see if they're willing to let you come and speak to your Bible study group, because we have someone who deals specifically with AIDS and sexually transmitted disease. That's a member of our leadership team here at the church, because we understand it's an issue that impacting us. So, I can go on and on, but Derek can share your information with me, and I can walk you through some additional steps and make myself available for a Zoom call for you guys as well, or anybody who's on here, if time permits, to make that happen. But of course, we have time frame on this particular conversation. So there's a call to action that we have as it relates to this as well. And Derek, we'll move to you next. I think chat number 29 is some things that we have done here in our area. Let's see, yeah, bridging the gap, some of our regional impacts, and from the context of bridging the gaps is a international ministry that was started some 30 plus years ago to deal with a social issue in a community, and we've expanded to 4 separate non profits that we do various work with. And I want to specifically talk about Bridging the Gaps of Arkansas because we work specifically with the state on some prevention measures. One is that we deal with and we support churches, schools, grassroots organization on building capacity to be effective in prevention and intervention within our particular communities. And we connect the faith-based groups to these initiatives. For instance, when we took almost 300, well, actually 60 children and adults to Little Rock and I think Darla and her team are on here as well, for hosting a excellent next gen conference. And our children were excited and didn't want to come home because they learned so much work. So what I'm saying to you is that as an organization, we're engaged from a regional perspective in making it happen for our community. We have a coalition of TXK, where we bring in leaders and talk about the issues with faith leaders, prevention professionals, the police department, the public health stakeholders in those particular meetings as well. We share data, we do community outreach, and we cross all sectors, and we bring in people to talk about some of the tough issues. When it comes to funding and grant funding, we do workshops as it relates to grant resources and resources that are available. And there's some creative ways of doing that because of our partnership with the state and then with the University of Arkansas at Little Rock. We're able to do some mini grants. We have partnerships with foundations. We have a consultant business as well, where we are committed to really developing the leaders, not only here, but also globally. I wish I had time. I could show you a picture of us having a conversation with a pastor and a leader that has a school that's in Africa. And we talked to them, and they went with us to some of our training. They went back and implemented a prevention program in their school in Africa because they walked beside us for just a few moments to really, deal with those particular issues. So we're committed to this, and of course, I think they'll share my information inside of the message. If you can send me an email, preferably, so we can set up a time to visit on how to make that work in your community. And maybe, Derek, we can do one on just how to make it work in your community based on the feedback and the conversation we're having so far. So, Derek, I'll turn it over to you.
That sounds like an outstanding idea, Bishop Riley. Thank you for sharing that. I shared with y'all the beginning of a logic model earlier, and I just want to show you from head to toe what it looks like when you're talking about making it work within your communities. Again, we start with the problem, but next you have to move toward the inputs. What are you going to do? You're going to get that community data. You're going to get the right training material that's going to work for you. And then you start your activities within your community. And your activities are going to be things that are going to work within your community because you're looking at what's evidence-based. And it may be developing a shared mission between your faith-based and non-traditional providers to work together. So you want to recruit a diverse group of faith leaders in order to make this truly relatable to your community. Everyone needs to be involved. Get as many people to the table as you can. And then you start looking at what you want your outputs to be. And your output bits can be the number of faith leaders that are actually engaged in this action. And I say outputs for you so you understand you're going to, at some point, especially if you're looking for funding to support you, you're going to need to go and talk with people legislators, it may be, or whether it be private funders, and let them know this is what's going on. We saw a problem. This is how we're working to fix the problem. We have a shared mission, and we have this number of many of faith-based resources that we have distributed within the community. We have this many leaders that are engaged, and then you tell your story, your short-term outcome. What did we accomplish? Because that's always the question that's down the road. And at first, initially, it may be increased visibility of your messages, and it may be increased referrals from faith leaders to prevention services. You have an established partnership, but in the long term, and this was connected back to the problem, you see, this connects to this. You had a youth substance misuse problem. In the long term, what you want to see is sustained, active, faith-based prevention coalition that is working to fix that problem. And you want to see a reduction in youth substance misuse rates within your community. So I want you to take everything you've learned in this session today back to your pastors and your ministers and your leaders and your board members and explain to them, like, we have to have a discussion about prevention and how it works. This is evidence-based. Using a logic model is something that's going to not only support the work that you do, but it's also going to give you a way to share your story with others. And then you discuss how prevention can align with your mission, your church's mission, your coalition mission, because the role that your congregation can play in transforming lives and communities can be clearly stated right here in this logic model. And I encourage you to create your own. This is not the only logic model that can be used, but this is a model. This is a demonstration of how that logic model gives you the opportunity to share that story. Can anyone see how they could use this in order to demonstrate that they've been successful? Reverend Miller, did you want to say something? I think you unmuted.
Oh.
Oh.
I'm glad I wasn't on mute, but I'm glad I was being quiet because I get excited. But I was just writing notes and just saying amen, and I definitely the logic model. Yeah, absolutely. I learned mine from the Kellogg logic model, right? Yeah, going in seminary. Thank God, believe it or not, and they've been very, very valuable when you mold them to fit the context. So I love this refresher. So thank you.
Okay, thank you. Well, one thing I'm going to let Reverend Riley talk to you about again is time. And we've talked about that, like pastors and ministers, we're already busy, and community members, they're busy. Time. So, Bishop Riley, could you talk with them a little about the process?
Okay, the process is let's slow down a little bit, because what happens is that we think it's going to happen today. When you start working with the logic model and really working through the process, developing that particular logic model, and that's the readiness phase. Information, outreach, and recruitment, it takes time. You're talking about 3 to 6 months. Remember, we did not get here overnight. We're talking about something that happened years ago, and we're trying to fix this. So it's going to take some time for us to put this system in place. With it, what we want to have in mind is sustainability. Right. If we do it right, we're going to have this where it outlives us. We want the development phase. That's when we're going to develop capacity building, 6 to 18 months. And then sustainability, ongoing education, plan, and evaluation, 18 months to 3 years. It takes time to make this work. And all the pastors that are here on the phone, we understand that magical window of 5 years in, and you can really start making the impact that needs to happen in that particular congregation, because those first couple of years, we're filling each other out. But after a certain amount of time, then we can really do the work. So it's a process. And for those who don't know about logic models, we have PTTC that offers those programs. There are links to that. And really implementing the logic model in the planning of your congregation's activities and outreach is a very special thing to do. And that's part of what we've done as well from an organizational standpoint and work very, very well for our congregation because I want it to outlive me. Is what I really want to have happen here in this particular congregation in this area where we live. So the call to action. Okay, so we've talked a whole lot. When I was with training with the DEA this week in New Orleans, it was all about okay, what we gonna do? We have all this information. What are we gonna do with this information? All right. So the first thing that we want to do is I want to encourage you, if you're able to, form a task force that has a faith-based prevention push, not as a separate group, but a part of for those preventionists that are here. I want you to reach out intentionally to the faith community. If it's just one person, if it's 100 people, have some coffee. I'm telling you, it'll move you a long way. And if you host it at the right church or the right synagogue, you'll bring in some people as it relates to that. So the first thing is identify a small group of passionate people, youth leaders, health professionals, recovery advocates, those individuals who are intercessors, those individuals who can help you move this task forward. My challenge to those individuals who are preventionists that are here, when this group forms itself, we need for you to schedule some training. And we want you to schedule training, mental health first aid, trauma informed care, prevention education training for the church leaders and volunteers. We want you to help them. In Oklahoma, someone says we've started a faith based statewide advisory committee for prevention. That's what I'm talking about. And that's at the state level. In the state level, we want to push that down into the rural communities as well. The next thing we want you to do is to work on hosting a prevention event. It could be around prayer, recovery night. It could be a youth rally. It could be a community panel. It could be an awareness Sunday. Your event is going to serve as a catalyst for healing and connection. This event is going to reduce stigma, going to provide education, and of course, invite new partners into the mission. And then we're going to share that information with the leadership. You want to invite the right media sources there to talk through what you're attempting to do. So that's what we want you to be able to do. The call to action task force, schedule training, host a prevention event, share that information with leadership and these various different organizations and these board members. You want everybody to be involved in this because I'm here to say to you, substance misuse impacts all of us directly or indirectly. And then our next item is we're going to how might the information from today's conversation impact how you're going to strengthen and engage your community. How might the information from today's conversation impact you and how are you going to engage your community? What are you going to do with what we just shared? Is basically what I'm saying. What you going to do?
Feel free to open your mic if you want to. We have time for you to at least 2 or 3 people to talk.
And I have a friend, I'm going to do a call out on here. Dr. Sizer from my hometown is on here. And I'm going to do a call out on Dr. Sizer because he's done some magnificent work in Northeast Louisiana, if he's still on. And I'm sure he has some insight that he can share with us as well on some of the creative things that he's doing there. Doc, I'm not sure if you're available to talk at this time, but if you're able to, I would encourage you to share what you're doing there in Northeast Louisiana. If someone from his team is on, that can share some information with us. Or is there anyone else who wants to share?
Well, I'll talk again.
Thank you.
So I appreciate it. I have something that's in vision stage. We discussed with just the worship leaders. I have a little journey groups that I do with some youth that are not members, but And so I'm planning some things in the fall. I want to speak real loosely about it, but this the event, the Recovery Sunday model, the to normalizing the conversation. I'm gonna be praying about and with my small group to see, because I'm wondering if that that vision that's coming up for the fall that we want to begin to experiment with might be the first theme or focus. So I thank God for that with regard to prevention, a safe space for worship, prayer, prevention, just relationship building. Secondly, I
Mhm.
do want to thank you for asking the preventionalists online, and I'm going to be praying about this, to assist the pastors and church with training schedules and things like that. Years ago, I did the mental health first aid, and that was always a vision. And they do it for seniors. They have, like, I don't have to tell you, very different, all kinds of contexts, young youth, seniors. And I've been wanting to bring that to my church. We have space to bring the training for the community, but the process of finding the trainers that can come. I went through my denomination. This is it's available, but it is a process that pastors could use help with if people in the congregation are not able to navigate it. So I'm going to bring that to my coalition in Westwood and ask any of preventionalists if they could help us with that from the clinical environments, with getting these connections, and we provide the space and, to collaborate. So I thank you for pointing that out, reminding me of now I can use that resource to help me in my community to get this done.
Yeah. And most of us, I don't think we understand that there are people who are in your area who this is their job to actually come out and
Exactly.
have conversations with you
Exactly.
about substance misuse. And then, of course, we have CACA, we have individuals who with SAMHSA, we have individuals who are faith leaders who are willing to do this as well, to come out and share with congregations around the country as well, because I do some work internationally as well as it relates to this. So we're willing to make it happen, whether it's Zoom. Thank God for Zoom now. And so we can share strategies that will help all of us, deal with this particular issue, because these programs come and go. But as a church, as I said, or a religious organization, we're here to stay through eternity. And so it's important for us to be able to utilize those particular um, avenues to make things work for us. So just want to say thank you all very much for being here with me, being a part of this discussion, this dialogue. We have more things that we're going to do in the future, and we look forward to really, working with you and helping you through this particular process. And I want to thank the leadership there and in Oklahoma, at the University of Oklahoma, for consistently inviting me to have conversations around this particular topic. This is my passion. This is my desire, because I know that we can make the difference in the lives of individuals that are in our community that are hurting, that just need information to help them, that's sensitive to who they are as individuals, and removing the stigma that is plaguing our community around this issue of substance abuse and substance misuse, which is a new term. So I thank you guys very much for being here. I will post my email address in here if you need to contact me, or of course, Derek's going to share some information if you need from him. So at this particular point, Derek, thank you again, brother, for being a co-host with me. And I look forward to our next opportunity to work together.
I want to thank you also, Bishop Riley, for your presence today. And I thank each and every one of you for your participation. I want to make sure that people leave encouraged. We feel that we've had the opportunity to equip you, but you need to feel empowered to do this work. So I encourage you to stay in contact with us. Get connected to someone in the prevention community within your community. Like Bishop Riley said, there are people who are paid to do this work in your community. We're here to serve you at the PTTC as well. We want to help on this journey of healing and hope within your community. So by leveraging those shared values that we all have in building trusted relationships, we can build a deep, deep community movement that will allow the faith communities to help reduce stigma and promote healing and offer prevention messaging on a regular basis within our communities. Because these strategies often include, education, mentorship, family engagement, community outreach that's rooted in compassion and spiritual support, things that you know about already. These are things that you are already committed to doing. But collaboration between public health professionals and the faith community fosters sustainable prevention efforts, and it encourages cross-sector learning, and it builds trust among populations where that is so needed right now within our community. I get so tired of hearing the words out there, fake this and fake news and fake that. Well, we got real people here right now that want to do the work, and we believe in it, and we know that these things work. This is real. This prevention is real. It's not fake. And we can help transform the systems within these communities that are allowing our youth to fall through the cracks, and we can build up our protective factors within our community, and we can reduce those risk factors within the community so that we can have a stronger community that's going to be sustainable over time, because we're working together. It's all about being together. We do have a little bit of time now to hear from you. So I want to open up the floor to questions. If you feel that you don't get a chance to answer your question, you can put it in the chat, and we'll get back with you on the questions that are answered in the chat. But if you want to open the mic and ask your question, you can do that as well. But we're going to be monitoring the chat, and also give you the opportunity to open your mic and ask some questions as well. So let's hear from you. What are your questions?
How do you get past the stigma? How do you get people to talk about the fact there's a problem in the family?
Oof. You
want to take that, Derek? You want me to take it? Yeah.
You can take it, sir.
Okay. All right. So the first thing is that you have to be willing to have the conversation. I mean, and I know that there are people that don't believe that there are issues like this. However, we have to be able to hang in there for the conversation, because it's a tough conversation when you're talking to a family member about their loving son or daughter who has a substance misuse issue. But you got to hang in there for the conversation. And sometimes we have to slow down the conversation. Because when the person trusts us, I know in counseling that I do, it may be 3 sessions before I really find out why the person is there. And the first several sessions is about, can I trust this person and open up with what's really going on with me? So sometimes it's about establishing trust first early on, and then from that point moving forward with what we want to talk about in this heavy topic of substance misuse for my baby that I love and I've spent a whole lot of time with raising. They just cannot be using this particular substance illegally. And so I'd encourage you to slow the conversation down, build trust and rapport with those individuals, and then continue to move forward. But we can talk more offline on that as well, on some techniques on making that happen. And we can get some other folks who are more expert at this, breaking those particular barriers as well.
A major part of doing that is like we talked about earlier with the data. You have to normalize sharing the data, because so oftentimes people hear about the bad news that you have to be the one to share the fact that like 85 or 90% of youth never use substances. So therefore you start getting normalized and understood that like we have a lot of good youth here, but we have to also pay attention to to our youth who are falling through the cracks, and let's move them over there. We can get to 100, but we have to start talking about the fact that a lot of times it's misunderstood, and people think like, well, because especially if you ask youth, if you ask them the question like, how many your peers are using substances, they may say 50% of my peers use substances. Truth is, 80% do not. So you, in opening up that conversation, you help to reduce the stigma and bring real stats and real numbers to it. When we're looking at on the prevention side, it's not about waiting until something happens. It's about creating an environment that protects the youth from those things happening to them. And the church has been so great. We don't take anything away from it in the past about saying we're going to support recovery. We're going to support recovery. But we need to move to the other side of the spectrum and say we're going to support prevention.
Okay, those are great answers. But I'm talking about the stigma of the person who's in the family who knows there's a problem in the family, but they're afraid to talk to anybody about it.
Yeah. And that's about creating this safe space for individuals. And we could talk a lot offline about that as well, because there's a lot of stigma that is there around individuals who are using drugs, and I mean that it's plaguing our entire communities, and that's part of the issue why we're having these conversations on how can a faith leader engage that family at a point where they're willing to be true to what's really happening there. Even the person who is the one who is using the substance, because there's some people who are in denial. But that's a whole nother discussion. And of course, we have a set time on this, and I want to respect everyone's time for today as well. And Derek, I think we can, there's conversations that are happening in the chat as well.
Yes.
There's one thing there's an Alabama person from Alabama who mentioned a certification program for faith leaders. If you could send us that information so we can share that with everyone, that will be great. There was someone from Alabama, I saw that in the chat. Faith-based support specialist, a certification program and curriculum backed by the Alabama Department of Mental Health. If you can send us that link so we can figure out how to open that up around the country. So if we thank you very much for sharing that with Tawana with us, because that's what I'm talking about. If there's a way to get people certified, we can have these conversations. It's past us, and we've done our job at that particular point. But thank you very much, Tawana, for sharing that information with us as well.
And Natalie also shares sometimes reducing stigma and building trust in conversation can be strengthened by believing that people want to be their best selves, even if they aren't showing up as their best. So, and again, it's about building trust to reduce stigma. And okay. So, in closing, just want to thank you all for being here. This is how you get in contact with me. I know how to get in contact with Bishop Riley if that's the contact that you need. You can reach me at dlnewby@ou.edu. I encourage you to come to our website and sign up for our mailing list. And also, we have multiple products there and resources for you as well on this journey to help you and support you. So join us here at webinars, but then follow up by joining our mailing list and also coming to our website and utilizing the resources. I would be remiss if I didn't thank my team. I want to, of course, thank Richard for being our technical supervisor here today and making sure everything ran smooth. And my partner, Wanda Hudson. Wanda, thank you for being here and all the work that you did to make this successful. Again, you'll be getting an email from Wanda. She's going to be sharing this information from today with you. The slide deck, it comes with all the resources that were used to create it. And did you have anything else you wanted to say, Wanda, before we close off?
I don't think so. Just be looking for that in about a week. Thank you all for attending. It was a great discussion today.